Good afternoon, everyone, and welcome to today's webinar, Strengths and Challenges in Entrepreneurship. I have the honor of introducing our president of the District of Columbia Public Health Association, Erin Buchanan. Erin has a few messages for you on behalf of DCPHA. Thank you, Erin.
Hello, everyone. Thank you for joining us tonight. This event was sort of born out of an interest in how public health and entrepreneurship intersect. We are an affiliated association of the American Public Health Association. We collaborate often with APHA and other organizations to build a stronger public health community, and to provide resources, expertise, and advocacy around public health. This meeting will be recorded, so if you're a member, it'll be available for viewing later. And I encourage you to join our organization. I'll put our information in the chat in a little bit. We have a really interesting and exciting webinar for you tonight, so please participate when it comes to the Q&A section, and thank you again for joining us. Antoinette?
Thank you so much, Erin, and thank you all for attending today's webinar. I am your moderator today, so if you do have any questions, feel free to individually reach out to me or please type into the chat. And now I have the honor of introducing our three speakers today. Our first presenter is Charlotte Hughes Huntley, CEO and Principal Consultant of Dr. C.H. Huntley, LLC. Dr. Huntley is a recognized leader in the public health industry. She has over 20 years of successful experience in healthcare and public health as an accomplished epidemiologist, microbiologist, consultant, business coach, and podcaster. Dr. Huntley serves as the CEO and principal consultant of this LLC, where she offers strategic epidemiologic consulting solutions to organizations within the public health sector and health-focused industries. She also offers business coaching to support public health entrepreneurs, empowering them to develop businesses, coaching to support public health entrepreneurs, that drive positive outcomes. She enjoys being creative, exploring entrepreneurial paths, and finding unique solutions to address public health challenges. She has created her signature communication style by utilizing podcasting as a medium for reaching professionals around the world, connecting within an authentic and engaging manner. She is well respected and recognized expert in public health podcasting, with the podcast included in the top 15 public health podcast list and listed as Public Health Epidemiology Conversations Podcast. Dr. Huntley holds a PhD in public health with specialization in epidemiology, a Master of Public Health, as well as graduate certificate in clinical research administration. Our next speaker, as I admit some people in, my apologies. Our next speaker, Latanya Bynum, is the CEO and founder of URA Resource Center, LLC, a public health consulting firm established in 2017 in Arkansas, with recent business expansion into Florida. She started her public health business with $500, a laptop, and a wild dream to make a difference based on what was missing in the public health industry. The firm offers 20 plus revenue generating academic, business, career, and dream ABCD public health programs. Signature ABCD programs include resume building templates, CHES exam preparation, business consulting, career mentorship, book authorship, government, private contracting, and more. Since 2019, Bynum has led 20 undergraduate BS, PH, and graduate MPH level public health interns and around 10 through the URA Resource Internship Mentorship Program. which provides the next generation of leaders with innovative training in creative and technical writing, public speaking, and research data analysis. Furthermore, several of the intern mentee alumni have gone out to start, grow, and scale their public health businesses. Bynum holds a Bachelor of Science in Health Education with a concentration in community health and Spanish, plus a master's in public health with an emphasis on health policy and management. I'm happy to say Bynum is recently an MCHES certificate holder. Congrats to you. She has self-published 3 books entitled Tools for Success 101 FAQs about public health, Mind Your Business, Are You Okay? Ebook project, The Opportunity Paperwork, Learning the Basics of Documenting Awesome, and book in the works, The First Touch, to be released sometime soon. Books are available for purchase everywhere. Amazon, Walmart, eBay, Target, you name it. I'm sure she's going to plug her website in the chat for more information. Our last but not least speaker for today will be Aisha Moore, founder of Self-Care by Aisha. Aisha is a stress management expert and self-care advocate. She helps women who are leaders in the workplace, but who are experiencing burnout, to learn how to take control of their lives so that they can take off their capes, carve out time for themselves, and experience inner peace. Since 2014, she has been sharing practical strategies to help women get serious about their self-care. Super excited about today's panelists. Hope you are too. I'm going to hand it off to our first presenter, Dr. Huntley. Thank you.
Thank you. This is really, I'm so excited to hear from my colleagues tonight. And thank you for holding the space and really highlighting this topic of entrepreneurship and public health. I really believe that this gives us a unique power in a sense. So many of us we're very scientific, we're very analytical thinkers, as you know, by the trade and by the industry of science. But at the same time, a lot of us are creatives, and entrepreneurship and bringing it with public health gives us the freedom to kind of spread our wings and really just be who we are. So I'm going to share with you my journey, and it's ever evolving. So the longer I work in this space, the more I learn about myself and the more I'm able to help and serve. I do have a very strong background in healthcare. I worked at infectious disease, microbiology, laboratory diagnostic testing for many years. And I transitioned into public health, still working in laboratory settings. So I worked for the state public health organization here, and I worked with the Bureau of Laboratories, and I did surveillance and more testing, and worked and collaborated from our state with, the federal level with CDC. And that's really when I began to start thinking more broadly about what I wanted to do in this population health impact. So I had a love for epidemiology, and it was a natural kind of transition for me, having that background of infectious disease and surveillance and so forth. And I worked in epidemiology for many years in commercial industry. So I left the state, I worked in pharmaceutical industry and really loved that. I learned about clinical research process and really was in a place that I was just really happy with the work that I was doing, and just really in a happy place, in my dream job, air quotes here. And then I had, I guess, a bit of a void or a gap there, because I needed to do more. I felt like there was just more that I could offer. And people were starting to ask me a lot of questions, especially on LinkedIn, how did you get into epidemiology? And, you have this degree or these degrees, and you're actually doing the work. And they had questions. And that was the first time I had a clue that there were a lot of people who had their degrees, but they weren't working in the field or weren't doing the work that they wanted to do. So I actually started my podcast as a way to share the information, because I was answering those questions, individually with people through LinkedIn, but a lot of different people had the same questions. So I started the podcast as a way to reach more people. I thought, surely there's more people, sort of like our scientific, we have an indication, this is a sample size here. So surely there's more people that have the same type of questions. My mind is always going back there. And so I thought this will be an easy way for me, because I love listening to podcasts. It was easy for me to share what I was already sharing in the messages on this platform. And it took off really quickly. So people really love the topic, really love the podcast. And then it led into people wanting to work with me more closely, because they would get, okay, this podcast is great, but I need to like meet with you, and because I have some specific questions. So I started coaching, and that's how my business started to evolve and started to grow. So the more I took steps, the more I felt free. I felt like, oh, I can, no one's telling me how I should do a certain thing. When you work for someone else, you are always advancing the mission of that organization. And it's great when your personal mission and what you care about aligns with that company. But for me, it was still a little bit of extra space there, a little bit more that I could do. And the more I kind of expanded and grew, the more I realized that I had more to offer, and I could really help more people. This whole podcasting thing, I fell in love with that. So I thought, okay, if I'm going to invest this much time into a podcast and this much of commitment, I've got to start monetizing. So then, my business hat came on. And then I had to really invest in a lot of training and coaching, and because we were scientists, right? So I needed to learn the business aspect of things. And as the more I helped people, the bigger my community grew, the more people wanted to know, okay, well, how do I do this thing that you're doing? I want to be a consultant. I want to know more about entrepreneurship. And so I began to help more people. And then it became, as something clicked, and I realized that I need to help people really experience the level of freedom that I was experiencing. So I wanted all of the people that were coming to me were brilliant. I mean, we're talking, all of us in public health have a heart to serve, and we really care about people and our populations, and we get really passionate about the things that matter to us. So I thought, if I can really start to impact more people who have that thought and that feeling, to spread their wings and really move into areas that, filling the gaps and starting to do more of the things that light them up, then we could really make a difference. Because when you have a passionate entrepreneur in public health who has the courage to stand up and do, be themselves and lead in the area that they're called to lead in, then we can, and I feel like I'm preaching. I often do this when I get passionate about my topic, but, we can really reach people in a way that CDC, NIH can never reach. So it's not that I'm anti, because one of my biggest partnerships are with CDC and these organizations, but see, they value the position of the entrepreneur, because they know that we can reach these spaces. So when you partner with the bigger government structures, the organizations that are larger, then we have greater impacts on populations. So going into this, no, I didn't have a clue that that's how it worked. But the longer I work as an entrepreneur, the more I spread my wings, the more I work with my clients, I learn more and more about the power of entrepreneurship and public health. So for me, it has become a journey of really realizing that I can help far greater people, individuals, communities, professionals, and have much greater impact if I can step outside of my comfort zone and be more of who I am and be more visible and just continue to help more people. So I invested even more into podcasting platform and into coaching. And there really came a point where my business was really growing, and I decided that I had to leave my role as an employee and close that door and really step full force into the business. And it was not I hate my job, I have to leave, because I love my job. I love the people I work with. But they were so supportive in sort of the send off, and which they still are like biggest cheerleaders in the background. But it was just an opportunity that presented itself to me, and I was able to realized that I can always get another job, but I may or may not have recreate this opportunity. So entrepreneurship is a mixture of courage and expertise, and really just believing in yourself. So I love the field of public health. I value all of the people who represent the different areas of public health. And my platform is one that I share with people that, want to learn more about entrepreneurship, and those that are working in the field, so that we can collaborate and just have a stronger presence and really support each other. So that's a lot about me, but I am going to stop there, and I'm going to hand the mic over to LaTanya and let her share her story. Thank you all for this opportunity.
Thank you so much, Dr. Hunley. That was good. You were preaching to me as you were talking. When I was thinking about you talking about mentorship and, just courage, like everything you were saying, I'm like, yeah, she's taking my presentation all the way over. So my name is LaTanya Bynum, and I actually started my entrepreneurship journey January 2017. It's funny how it happened. I was at a conference for my day job, and there was a lady, shout out to Miss Kyle Cameron, and she was about to have breakfast, and I saw her. And you know how when you see somebody, you can just like pick up on their spirit, like that's somebody I need to talk to. So I looked at her, and she was looking at me, and I was like, you want to have breakfast together? She was like, yeah. So we sat down, and it was just a great conversation, and I was pouring into her. And through that conversation, she was like, oh my God, I wish I would have met you like 3 years ago when I started in this position. I was like, funny thing that you say that. I feel like the same way about what I'm doing now. And I was in the Office of Rural Health and Primary Care at the time. And so long story short, my business started as a result of me just pouring out into a total stranger at a conference. And so during that conversation, she was like, I got to get you to come to Wyoming and talk to my group. And you know how people tell you they're going to do something and they really don't follow it up. They just try and be nice or whatever. And I was like, okay, yeah, that's fine, call. But she followed up and called me, and she was like, excuse me, she was like, LaTanya, I got the money. Can you come to Wyoming? And I was like, what? I said, how much money you got? And she was like, I got $3,000. I was like, what? For what? She was like, I just need you to come and speak to my people. Like, for how long? 30 minutes? I was like, I'm there. So that's when like my entrepreneurship light bulb popped on. And I was like, how can I take this $3,000 and really like ramp up everything? And then like, I don't want to catch a plane. Maybe I can drive. So it was me, my husband, my 3 kids. We drove from Arkansas to Wyoming. I think it was like a 18-hour drive, but we made it there, and it was a great experience. My first government contract. So long story short, everybody's journey is really different, but my journey started with just a simple sharing of information and really just, having a great conversation. So one of the things that I pride myself in is just sharing resources, because I remember feeling lost. Drop a 1 in the chat if you ever at some point in your career, whether it's been your business or, whatever, have you ever felt lost? Drop a 1 if you felt lost. And when I got into public health, honestly, I felt so lost, y'all. I was a family first. I'm the first bachelor's, the first master's, the first business owner, the first book author, first app developer, first to get married, then to have kids. So I'm doing a lot of things that nobody is like, LaTanya, you're doing great. They're all just looking at me like, what? Like, what you gonna do next? So this family first is a challenge, because at first I was like, oh, people want me to be perfect. And so that is why I always try to tell folks the truth, like right up front. I don't know what I'm doing, but I feel like I'm doing something that makes me happier. And I do remember working in public health and thinking, dang, that we're missing so many opportunities, but because that's not in my job description, I can't really do it. And so a lot of what I do in my business, URA Resource Center, LLC, is really just sharing tools, resources that are often overlooked and untapped. And so what I want to, excuse me, what I want to go through are 10 resources that, like, when I started out, if somebody would have told me about these 10 resources, I'd have been like, 17 years in public health. But if somebody would have told me, like, pay attention, like, this is how you get your entrepreneurship journey on. Thank you, Aisha. This is what I would tell them. And really it's about being nosy. Drop a 1 if any of you are nosy. Drop a 1 for nosy people. Some of y'all are nosy. Yes, okay. So, and drop a 2 if you're not nosy at all and you don't like looking up people. You didn't even look me up to find out like what I was about. Hey, my friend Angie. Good. So we got some nosy people. So I want you to be nosy on these websites and find these resources. So the number 1 website, excuse me, y'all. The number 1 website is LinkedIn.com. LinkedIn is where you're going to find all your public health friends. And so I got on there immediately, just add people like Dr. Hunley, because she had all them credentials behind her now. Like, I'm just trying to add everybody with an MPH or a CHEDS. So that's like a technique. You just get on there and you add a bunch of people, because my thing was, in Arkansas, I already know these people. I'm trying to meet some people that I don't know. And maybe they'll like me. You know what I'm saying? Hootsuite.com. That's your scheduling post for social media. You can put up to 5 posts. A lot of people see me on social media, LinkedIn. They think that's really me, but really that's my content scheduler. Hint, hint. So you just got to put yourself out there on a consistent basis, and eventually people will be like, hey, she's showing up every day at 3 a.m. Let me check her out. So Hootsuite, Buffer, and Planoly are 3 resources that you can really get yourself out there really good. Dr. Hunley talked about mentorship. Now, if I would have had a mentor early on, which I didn't, I probably had just a couple of folks in my family who started a business, but they weren't immediate family members where I could just ask them questions. And so SCORE mentors, score.org, if somebody could type that into the chat, score.org is a organization that allows you to get free, no-cost mentorship, score.org. Shout out to Jim Sadler, who, after Kyle talked to me and she was like, listen, you want to go through your organization? Like, you want to go through the health department to come here, or you want to start your business? I was like, I'm going to start my business. So in 3 days, with my $500, my dream, and my laptop, I set out and filed my LLC, went to the IRS website and did my EIN number, set up my Duns and Bradstreet number. I got all my stuff together in 3 days. And I told Kyle, like, here's my quote for coming, here's my invoice. And she was like, oh my God, like, you for real? I was like, yeah, you can. I need that $3,000. I got 3 kids and a husband. We trying to, you know what I'm saying? So score.org is a great resource. You can find your best friend and a counselor. Now, here's like government contracting. I didn't find this out until like, maybe 2 weeks ago, that there's actually 17 levels. I used to say there's always room for growth. I'm still learning, like I told y'all, but I thought that there were only 11 levels to government contracting. And so now that I have my first private contract, I'm always telling folks there's 17 levels to contracting, and 16 of them are government. So, you got your school, city, state, regional, tribal, on and on and on. You can look them up. But the Procurement Technical Assistance Center, if you Google that, you get a free, no-cost counselor. So if somebody could type that into the chat, Procurement Technical Assistance Center counselor, PTAC, yes, they're going to hook you up and kind of get you into government contracting. And that's endless amounts of money. I mean, like millions of dollars. Remember, I told you I started my first job, my role with Kyle was a government contract. So that was good money, $3,000. Google alerts, google.com/alerts, because people are out here just telling you stuff. And I'm kind of like that super nosy person. I go find resources and I bring them to my people. So google.com/alerts allows me to be nosy. I have over 200 Google alerts set up. I don't look at all of them, but the ones that make sense for my business and also the programs that I operate, because when people call me, I need to be up on top of my stuff. I need to know what I'm talking about with the latest, greatest. And so google.com/alerts allows me to set up search engine optimization keywords so that when things pop up in the news, or like I followed Dr. Kamara Jones and Dr. Adwele Troutman when I was starting off, because I knew they were like cutting edge. She's talking about racism. I'm like, oh my God, like she making people cringe. Like, that's what I want to do. So like, I was just looking at people like that, and Nipsey Hussle for the entertainment industry, because I'm like, I'm trying to do something different in public health. I want to kind of do, say something weird. So I just started searching for information that really people weren't going to tell me, but I looked for it. And that is how I really started like compiling my resources. Now, this is the third resource as far as free coaching. The U.S. Small Business Administration offers a business opportunity specialist. If you Google that, if you put that in the chat, business opportunity specialist. So this is a person that is either locally, district wide, or statewide, or nationally connected, and they offer resources to you to get you those opportunities, whether it be at CDC or wherever you want to go within the 16 levels of government. APHA.org, of course, if it would have been for my state chapter of APHA, I probably wouldn't be here, but just being able to bump shoulders with people that I wouldn't work with normally on a daily basis. Like one time I was on a project where I got to work with the lawyer, and I was like, oh my God, I would have never worked with him. But we were working on a project for the awards, handing out the awards for leadership in public health. And so we were able to work together. And so I was like, okay, I like this. I get to meet and work with and connect and engage with people I don't normally work with. Excuse me. And the last thing, kind of like Dr. Huntley was talking about, self-confidence. Now, honestly, I figured like to start off as an entrepreneur, you had to be perfect. You had to be like skinny, and you had to be like well experienced. Like, and I was like, dang, I ain't perfect, because like, ooh, we ain't gonna talk about that. Y'all have to read the book to figure it out. But not perfect. In no way do I have like know everything, even though I got degrees and everything, but I don't know everything. I'm still learning. And then there's always room for growth, right? Drop a one if you're always thinking like, there's got to be more to life, day job, one income. I'm trying to get some multiple streams, kind of like what Dr. Huntley was talking about, monetizing. I'm like, that's what I need to do. Like, I searched for a word on Google Alerts called social media monetization. That was a good term. If y'all can put that in there, you'll learn some stuff. Social media monetization, that was good. So I learned some stuff through research, just being nosy. But Toastmasters.org really helped me with my confidence in public speaking, leadership, and then also evaluation, like taking constructive criticism. Have you ever had somebody give you some feedback and you're like, how dare you? Like, I didn't ask you for this. So Toastmasters teaches you to listen, but take the good things from what they said and build off of it, and then just let all the other stuff go in one ear, out the other. So really, just to kind of follow up with my strengths and weaknesses, 3 of the strengths that I outlined on my little paper here. Strengths were resources, tools, opportunities, and creativity. I feel like that's why I had to quit my job May 14, because I felt like I needed a year to just work on like the business and figure out like if I could do this for real. So I saved up like $28,000, and I was like, I know I'm going to make it. And within that first 3 months, I got my first private contract. Drop a 1 in the chat if you ever thought that you could get a contract. Drop a 1, drop a 2 if you think you could do it, but not sure yet. Drop a 2 if you, okay. Some of y'all at Hermits, she's good. She actually helped me a lot with my first book on government contracting. So you guys can do it. If I could do it in Arkansas, y'all can do it too. So some of the strengths are resources, tools, opportunities, creativity, and things that I need to work on. Challenges would be, and I said weaknesses, but it's really not weakness, it's a challenge because I can overcome anything. Time, capacity, and experience. I remember one time I felt like I was gonna have a heart attack because I had started doing resumes. It was so many people, and Aisha can attest to this. It was so many people reached out to me. I told my mom, I said, my heart is about to bust out my chest because I can't do all these people resumes in 7 days. So I had to give a lot of refunds, and I know probably some of them folks was probably pissed off, but I just couldn't do it. And I said to myself at that point, I need to get me some interns. And luckily, thank God, one of my previous clients reached out. She was like, I want to be your intern. So that's what started me on the internship journey and working with the schools to get interns. But, in this journey, honestly, like I said, I don't know what I'm doing, but I feel like I've never had this much money. First of all, in public health, we're big on taking care of people, but I feel like for the first time in my life, I'm really like glowing. Y'all see that hair? Y'all see that? You see them little curl patterns right there? You know what? Like I never been this happy. Like marriage wise, I feel like we probably gonna stay married a couple more years. You know what I'm saying? Like everything is working out. And I feel like it's because I believed in myself and I decided to take a leap of faith in writing books, like just telling my business. Like people are like curious on weird folks, y'all. Like anything weird you're doing, just know in business, that's an asset. Like people love that weirdness. And so I just feel like anybody can do it. You just got to believe in yourself and you got to stop thinking you got to be perfect or you got to come from that kind of family. It's fine for you to do it just like you are. Just start digging into these resources and call some people. Call Dr. Huntley and ask her some questions and don't be scared to invest in yourself. Spend some money with folks. And because you're reciprocating, like you give, we give, like boom, boom, boom. It's like a back and forth. One of the things that I worked at the health department, I was big on saving people because I felt like everybody needed to be saved. And once I became a business owner, I was big on like, it's about investing, not saving. Like you got to invest in people. And so I think it was just a mindset shift from employee mindset to independent consultant mindset. Long story short, I know you can do it. Those resources are out there for all of you, free, no cost. Everything I mentioned was free. Like don't cost one dime, no pennies at all. Because, I only had $500 and I took $500 and here I am today, then quit my job. My husband thought I was crazy, by the way. But, I don't care. I'm like, we finna do it. I got the app, the books, like we finna go, So that's my story, but thank you so much. Thank you all. And we're going to turn it over to the great Aisha Moore.
So, LaTanya is a truth teller. She gave me my money back and was like, oh, I need to practice self-care. I was like, no, she didn't turn the self-care back on the self-care girl. I was like, no, she didn't, but we have to. We can't be afraid to know when we are at our limits because you run yourself into the ground and then she can't serve anybody, right? She can't serve anybody if she is not well. So I want to thank you, LaTanya, for honoring yourself that day. Are you available now though? Because I still need help with the resume. So I am so excited to be here tonight. This is a full circle moment for me, which I will explain for you all throughout the course of what I want to share today. And what I do know about public health, I've been in public health officially for 20 years, but I have been doing something public health related since forever, right? And many of us in public health are very passionate, but we do not pay attention to our, what's this? Money, cashola. We don't pay attention to none of that, none of our pennies, okay? And because a lot of us are not good at or pay attention to the math. So if you consider yourself good at math, I'm gonna do LaTanya style, drop a 1. If you're not good at math, drop a 2. See, I do that all the time when LaTanya not there, and I was like, dang, she here. Now she gonna know that I stole her stuff. All right, so we got a couple people who feel like they're good at math. One piece of, oh, okay, good at math. Okay. All right, well, that's good. So you guys might be advanced in this crowd because I see some people are good at math, but the thing that we don't think about is the return on the investment in being in public health. So the reason why I know LaTanya and Dr. Huntley is through a group called Black Ladies in Public Health. That's the one of many ways that I know them. And we're in the group every day and people are like, I don't know why I got this degree. It doesn't pay enough and that kind of thing. And it's like, well, part of it is because they did not look at their return on investment from the beginning, right? So for many of us, the cost of our public health degrees are the same as the people in the school next door getting the MBA. The cost of the credit hour is the cost of the credit hour. Sometimes they have to pay a little bit more, but a lot of times it's equal. But as we know, our job prospects are not equal. While there are plenty of six-figure jobs in public health. It's not going to be as many as lucrative as the MBAs or the lawyers, right? So then we come out of school, we start looking at these jobs, and we're like, this does not add up, and the rent's too damn high. What am I going to do? How am I going to increase my pay? So there's different strategies. So in the DC area, the two strategies I see the most are to get another degree, and still haven't quite done the math to realize getting that other degree is not going to necessarily raise your pay the way you think it is, or they go work for the federal government, right? That's what they do, because you can get pretty decent paying jobs in the federal government, right? So that's two paths you could take. So then I took this path. I decided that the way to success, to get more money in my pocket, was to build my skills, because when I got my MPH, I was hearing this message: oh, you have too much experience to be entry level, because I worked 4 years before my MPH at a consulting firm. And in college, I had done public health educational stuff. So they're like, oh, you're overqualified, right? And then I would go for senior level positions, and they'd be like, oh, you're not qualified enough. So like, what do you do? So I did find, a job and everything, but I was like, okay, so I know that when you're working a job, you only have certain opportunities, like what Tanya said, like what's in your job description. And if you want to be a leader, like you can't, that's somebody else's job. You can't just like go stepping on people's toes. So how do you find other places to be a leader, right? So what I did was decide to volunteer my skills, right? So right here in this organization, it used to be called the Metropolitan Washington Public Health Association, but now it's the DC Public Health Association. I joined what at the time was called their Health Disparities Committee, right? And just a couple of hours a week, we would go out into the neighborhoods and pass out condoms on the street. We would put condoms in like the laundromat, just places where regular people go, and people like in the corner stores, all of that. We were putting condoms all over the place. And therefore I started meeting people in public health in this area, started meeting, and then we have meetings to plan the outreach, right? So you just meet people that way. And so then as a result, the most public health associations, your local affiliates of APHA, so go to APHA, look up, find your local affiliate, your state affiliate. They're going to have a conference. Most of them have a conference. And so I'm a natural speaker. It's something I've been performing and entertaining since I was in beauty pageants when I was 5 years old, singing Diana Ross, Reach Out and Touch Your Hand, right? And so they asked me to be the MC of their conference. Then the next year, continue to volunteer. I asked to join their governing council. So their boards, so the boards of the public health associations are called governing councils. And then within a year, I became the president of that governing council. And my boss at the time used to come past my desk every day. And he's like, well-renowned, like right now he runs AIDS United. And he would walk past my desk every day and be like, good morning, Madam President, nice shoes. That's what he would say to me like every day, because I used to be about them shoes, right? And so then a part of being a part of that association, I got to be what's called the affiliate representative to the government council. So each affiliate then has a representative to the APHA governing council. So APHA would pays for those people to come to meetings, right? To meet with people across the country. They always held them in DC, so I didn't really get to go nowhere, but everybody else got to come along. And so then I was meeting people with 30 years, 40 years, 50 years of experience, really high level people, just by volunteering my time in that organization. And then, APHA, the conference happens in certain cities. And so if you're the president at the time that it comes to your city, so when it comes to DC, the DC president gets to speak. So Erin, I hope you get to speak. I got to speak in the opening session, 5,000 people. And I got to tell them that y'all not real about health equity. Who me, little me? I got to do that, but by virtue of just the title, right? And so then from there, because I am the president of the association locally in DC, whenever there was like a local initiative or some national thing, I was asked to sit on that. And so that was the value of volunteering my way to success, right? And it really, really worked. Oh my gosh, hold on 1 minute. Somebody's calling me. This is a boss that I had 7 years ago. I'm not sure why he's calling, but let's jump into this phone call. Hi, Stuart, how are you? Oh, it's so good to hear from you. Are you still at the same place, the same firm that we used to work at together? Oh, great. How can I help you? you have a job opportunity. Okay, tell me more. Tell me more. So you want somebody who has HIV expertise. Yes, yes. So, I've been working at my day job, but also as the president of MWPHA, we have this huge health disparities committee we work all in the community on HIV. We've lobbied the mayor. Like, I think I can do this. So it's a national project. Tell me more. Health communications. Well, I have a Facebook account, so that counts, health communication. All right. So when do I need to send you my resume? I don't need to send you my resume. Well, so what do you need to give me this position? I just have to tell you if I want it. All right, I'll get back to you tomorrow in a couple of days. All right, so good to hear from you. So just by doing all that volunteering, I started to get jobs without an interview. Hold on, I didn't close my notes. I started to get jobs without an interview. And that was actually the second job I got without an interview. The first one was a connection from someone in MWPHA. I was getting late. My grant was ending my job. I was about to get laid off. And they asked me what job I wanted. I told her 2 weeks later, she's like, oh, somebody at my job just quit with that exact same job. DC government, I applied for the job. I get an email saying they're no longer hiring for the job. I'm all sad. HR calls me and said, we want to hire you. I'm like, I didn't even have an interview. This is a government job. How does that happen? So just by volunteering, my reputation started to precede me, right? And so I was getting all these opportunities, but then I accepted that job that I got the phone call for. And I was so happy. It was like I was going to have director in my title because I had been praying to be a manager. Won't he do it? He gave me director. I took the job. And by the end of the first week, I was crying in my cubicle. What have I done? They email way too much. What is with all these meetings? I can't hack it. They call me at 7 a.m., call me at 7 p.m. First question the client asked me, ma'am, do you have a BlackBerry? I was like, I don't. And why you need to know? So I should have known from that first day how intense it was going to be. But because I was community service oriented, I worked my way to the director position, but I still have 4 jobs, right? MWPHA, the farmers market, Place Matters, this local thing in my community called River East Emerging Leaders. So I had 5 jobs, only one of which was paid and took a lot of my time. And that's when I started to have headaches. I started to have panic attacks. But really the real key, if I had caught this, was I used to lose my keys all the time. And that should have been clear that I was overwhelmed if I couldn't do simple things like know where my keys are, keep my plants alive, wash the dishes, not wake up in the morning and be like, is that the dirty basket or is that the clean basket? I'm not sure, right? A lot of us, we work really hard, we get these accolades, but the rest of our life can be chaos. And from there, I actually had to go on short-term disability. So when I came back to my job, I was like, okay, so I ain't independently wealthy. So how are we gonna make this work? So I started therapy. I took up all those extra jobs that were not paying me and did the job that paid me and paid attention to my husband. That's what we're gonna do because I just got married too. And people started noticing a transformation in me. I had more energy. I was showing up to stuff. How many of you are the type that like, you were like, why people don't invite me to things? Because you always tell them you're busy because you're trying to be Miss Superhero Public Health. So they're like, well, she ain't coming anyway to the happy hour. She's not brunching like that no more because she's about her grind and they respect it. So they leave you alone. See, she said drop one and I didn't even tell her to drop the one. They still dropping these ones. All right. And so people started seeing stuff in me. And so people kept asking me, what am I doing? Because they saw that I was joyous. They saw that I had energy. They saw that for the volunteer, I kept one volunteer thing. They saw that I was on it, right? They saw that I wasn't stressed out and they started to just see me out and everything. So people started asking me what I was doing and I kept typing the same email. So then I saw a friend out and he was like, let's go to brunch. And he's like, oh, I'm going to this workshop next week by this woman. Her name is Rosetta Thurman of Happy Black Woman. You should definitely look her up. And so I went on her Facebook page. She puts all these affirmations. I was like, let's go. I want to be in the affirmation. It was a workshop about becoming a business owner. So I was like, well, I paid $47. I'm going to eat this food, drink this wine, and what have you. And by the end of the night, everyone was like, you could be a speaker. You could be a coach. By telling your story, you can tell people how you transform. And so that is what I do. So the first thing I saw people do when the coins are not matching up, they get another degree, work for the federal government, my first strategy was to volunteer my way, to get some accolades, to be able to get opportunities to be sought after. But then the third way was to do the entrepreneurship. So building a business can be daunting. So you don't have to start with this idea of building a business. What you can start doing is selling your skills, right? And so earlier I was saying how a lot of us in public health don't do the math. So we end up with a poor return on investment on these degrees. I'm going to tell you about the math of public speaking and how you can shortcut your way to that public speaking career. So this is the math: your message, your availability, your talent, and how you want to be honored, right? Honoring yourself. So the message, all you need is just one message, right? You just need one message. I mostly give the same speech over and over. What is it? Self-care, the number one superpower for public health in the 21st century. And the next day I'm speaking of women engineers. Self-care, the number one superpower for women engineers in the 21st century. The next day I'm talking to social workers. Self-care, the number one superpower for social workers in the 21st century. And I just make a little customizations by researching those specific industries. So I just have one message. So what is a message that you can share? And this message needs, like, what unique perspective do you have? What problem can you solve? What life experience of yours can others work from? So that's your message, right? The A in math, availability. When will you be available? How often, right? Because especially if you still have a full-time job, you need to figure out, like, okay, am I available for 2 speaking gigs a month? Do you want to be like, okay, I'm only doing lunch and learns? Am I only able to do conferences? How many of my vacation days for my job do I want to use to do paid speaking gigs, right? You have to figure out, like, how available that you are and get a calendar going so you can know, like, okay, I'm going to do 2. I have the bandwidth for 2 a month. I have a bandwidth for 4 a month, or whatever it is. So if too many people start asking you, you know when to say, I am full for this month. Can we do this at a different time? Because sometimes people have, like, specific times, but other times they really don't. All you have to do is just, see if they have any flexibility. So the next thing is take advantage of your talent. So every speaker is different. Are you a more humorous speaker? Are you more of a storyteller? Are you more a teacher? Do you do things that are more immersive? Like, do you do things that are more tactical? That kind of thing. So figure out what type of speaker you are, because there's all different types. Like, one speaker that I follow, his name is Eric Thomas. He is, like, really rah, 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 rah. When I first saw him, I was like, boy, can you just, like, tone it down just a little bit? But I realized also I wasn't necessarily his audience. He was trying to talk to young men who were sitting on the couch playing video games. So he needed to yell at them like a coach to motivate them. That's not my audience. Y'all don't need me to yell at y'all. I talk loud, but y'all don't need me yelling at y'all, right? So you got to figure out, like, what your talent is. Then you have to figure out how you want to be honored. So remember, I had all those volunteer jobs, right? Yes, it's Eric Thomas, E.T. the hip hop preacher. Thank you, Latanya. E.T. the hip hop preacher. Go to YouTube, and they got a podcast called The Secret to Success podcast. He doesn't yell so much on the podcast, so I'm a podcast listener. All right, but the last part of the math, the H, how you want to be honored. So I was saying that I had all those jobs that were not paying me. And now I realized I was being honored. I was definitely being honored in terms of accolades, in terms of, like, all the thank yous and everything. But I realized I needed to honor my bank account because, again, that return on investment on that degree, that student loan needed some extra payments, right? That's how you get ahead, extra payments. So minimum wage in the speaking industry is $2,500 for a speech. $2,500. So all those titles that I just told you, when I sit down, people write me checks for $2,500. So it's not about the hourly, right? They're paying for your expertise and your impact. So, like me, I'm over here at $2,500. Eric Thomas, he's at $50,000 for the hour, right? So definitely there's people in the higher ranges, but $2,500 is nothing to sneeze at, right? It's nothing to sneeze at all, right? And so that's, like, on the low end. But what if this person doesn't have a speaking budget, right? Then you decide again, how many pro bono engagements are you going to do, but they're never just free, right? So one, I always try to figure out about who's in the audience. Are the people in the audience, do they have checkbooks? Are they people who write checks from their organizations? Because if it's a room full of people who can write me a check, I know that I could get a gig from that. So I spoke to a women in engineering conference, and then electrical company hired me. I'm a public health educator. My degree is health behavior and health education. I'm speaking to people at an electrical company. On the hush hush, I won't say the name, but y'all figured out. But that pasta in the blue box, I'm in negotiations with them as well, right? So I've taken this public health to all the different places. So if I can't, so I try to get that, make sure the person can write a check. If not, can I get a recording of that footage? Because that's marketing for me. And I will also ask, will you do 3 introductions for me to people that you know that have a budget? Because they have friends who have budgets, right? So there we are. So that's all I wanted to say to you guys today, is that getting another degree and going to work for the federal government are not the only ways that you can level up, right? And for me, it took volunteering to get there. I probably volunteered too long, but if you want to just do this without a lot of money, low barriers to entry, then speaking is what I recommend. Thank you.
Thank you so much to all 3 of our speakers, Dr. Huntley, LaTanya, Aisha. You all brought different aspects of entrepreneurship, and I think that full package really has hopefully inspired all of us on today's webinar. Right now, we're opening it up for Q&A. We do have one question in the chat about the financial process. When we're talking about, and this is for everybody on the panel, talking about preparing to leave that full-time job and starting your own thing. Maybe if you can give us like 1 to 2 examples of how we can set ourselves up for success, that would be great.
Dr. I don't know. I'll go first. I'm big on my personal checking actually was the main funding source for my business. Kind of like I started out like $500 until I got that first government contract. It spilled over. But for the longest time, I was just navigating my finances through my personal checking until I learned better that I needed to really start tracking my funds and my business checking, kind of getting my ducks in order, because I knew I would probably get audited. And, so I just learned from experience. But one of the things that I know that helped me to be able to leave my day job was really 3 things. One was an Excel spreadsheet. So I started off on like paper and pen, just tracking my budget, my savings, clients, like how many books, and like I was just doing everything on paper. And then I was like, hey, I need to put everything into a document. And so I just started tracking my personal checking and my business. And I really started maxing out my 401k, because at the company that I was working for, they did a match. And I was like, oh, I need to like capitalize on this. And so it took me 4 years, and I saved up. I was like, well, in Arkansas, I don't know how much it costs for you guys, but I was like, I need about $28,000 to really live off of for a year. Like that'll make me comfortable so I don't have to stress out. And so I saved up money. And May 14th, I was like, it's time. Like I done turned in my 2 weeks notice. They love me and they still want me to come back, but it's been working. So I've gone from like 1 year to now I'm on like my planning for my 2nd year to be off. So I'm just kind of doing it as I go. So I would say really, get you a good business checking account where you can monitor your finances, really start strategically planning out like how much money do you need to live off of, just in case you're not killing it with the, public speaking events, or you're not selling books or whatever. So if there's some downtime in your finances, you still have some cushion where you're not like stressing yourself or yelling at your husband on he needs to go do something and go to work or something like that. So, just really thinking about your tracking and your performance of your business is really going to be key for you, transitioning into working full-time as a consultant. I hope that helps.
I don't really.
Oh, I was going to add. Oh, sorry.
Go ahead, Aisha.
So I haven't made that leap yet, but it goes back to the math, like figuring out how these things cost. Someone was asking about the a 401k, right? And your health insurance, right? It's just a simple math equation, right? So let's say like health insurance is expensive, right? I'm not saying that it's not, right? So let's say it's going to be like $1,000 a month. I'm like, okay, health insurance, trying to save or whatever. So I'm like, okay, speaking engagement number one, $2,500. That's going to pay for that. All right, speaking of engagement number two, that's going to pay for my mortgage and, you know, the basic bills. Speaking engagement three. So really just like breaking it down to say, okay, when I get check number 1, 2, 3, 4 in a month, then it's going to go to these certain things. And so that's why you have to charge enough. You can't be charging these little tiny wages, because then Uncle Sam's in your pocket, your insurance is in your pocket, and you need to be able to, you're not going to be working 365. So you also have to think about, okay, I need to make what I need to make in about 250 days a year. Like that's about what most people can work, is about 250 days actually. So you got to make what you can make in 250. You can't be doing like, oh, how much I make in 365? You're not working 365. You got the weekends, and you better plan that vacation.
Yeah, I think that I like what they're both saying. When it comes down to, I think this was probably the biggest question on my mind for a while, as I got, especially as my business was growing, and I was getting close to that kind of capacity on both sides, you know, and as far as being an employee and trying to do the business, I'm just going to tell you right up front, it's going to be uncomfortable. So if you think that there's going to be a point where it's magically beautiful and perfect and everything's aligned and you just kind of move over into, you know, the entrepreneurship 100%, it doesn't exist. So it's going to require you to have faith and believe in yourself. And you have to you have to look at your numbers. You have to know what you need and what you're willing to risk. But you really have to believe in yourself, and you have to be ready to get uncomfortable. And I think that LaTanya's example is great, because she just decided, you know what? If I'm going to make this work, I need to know for myself if this is going to work or not. So then she just decided to get whatever amount she needed, and then she was just going for it. With me, I was growing to that point where I loved the job I was on, but this business I was falling in love with this business, and the potential and the opportunity was wonderful. So when I got the really big contract, it was actually a consulting contract. It wasn't that it matched my salary and I could comfortably move. It was the opportunity, like that enough had validated itself, and I was ready to take that chance. And my husband's my biggest cheerleader. He's like, I've been telling you should have done a long time ago. So it wasn't like no one was holding me back but me. I was ready, and I just decided I can get another job, but I may not be able to create this. So I did it and never looked back. It was the best thing I could have done. So I think it's just going to look different for everybody, but you have to look at the numbers, do the math, do all those things. But bottom line, you have to decide to believe, you have to really believe in yourself and be confident and just do it.
Well said.
Thank you to our presenters. We do have 3 minutes, and we do want to be mindful of everyone's time. I will grab another question in the chat. We have a question about graduating from undergrad in May, has aspirations in entrepreneurship, but what tips can you give to help, I suppose, young professionals? What tips do you have to help maximize their network and building relationships with mentors? Again, if just maybe one per speaker, or maybe just one of you wants to speak on that question, that'd be great. Thank you.
I have a quick answer. Join your local public health association.
LinkedIn for me.
Ditto. I think I was going to say LinkedIn, and don't be afraid. We're real people behind, you know, I'm a person with a lot of letters behind my name, but don't send a canned standard, you know, boring, bland. Don't do that. And don't just send a connection request without a message. One of the best things I get is when someone says, oh, I listened to your podcast. This is great. Or I saw you at this. This is great. We're both from the same area. Something to connect with them. They're real people. Just have conversations.
And then I'm sorry if I mispronounced this. Is it Neshi?
It's Nashay.
Nashay. All right. What's your question?
So for me, I'm graduating with my master's in public health in December. But what I'm battling now, already kind of started my business and my focus I want to do, but I don't have that much experience already, like prior to this, outside of working in healthcare. What advice would you have for me? Because I'm a mother, I'm a wife, and having that freedom to be a mom, I feel like I can do that with entrepreneurship and also do my passion. But for some reason, I'm stuck and like figuring out what I want to do. So, like, what advice would one of y'all have for me?
I'll speak as a mom of three, a wife, and just, all these interns. I think it goes back to what Dr. Huntley said. Like, there's never going to be a perfect moment. And kind of like Aisha said, you just got to know how much you can take on, right? Before you just tap out. And I've been to the ER twice over this work when I finally learned a better way to do it. And so I think it really depends on the resources that you do have. Also, just looking around you. And I think sometimes I was thinking I needed more, and I really did. It was just the people that I was around. I didn't tell them what I wanted to do. And so they just didn't know. And so how can people help you really, level up if they don't know what your intentions are? And so really start talking about what you're doing, kind of like what I was talking to Kyle about. I just put myself out there. Like, I didn't know if she was going to call me back or not, but just put yourself out there and you'll be, 90% of my clients in that first year after I worked with Kyle came from LinkedIn and Black Ladies in Public Health, 90%. So those people didn't know me. And I always believed in stranger danger before that. So it really works out if you just put yourself out there. Okay. You can do it.
I know we're over, but I really need to speak to Nisha. I want you to start thinking about changing your language. You said, I don't have a lot of experience. You can flip that to say, I'm going to get the experience I need to live this dream that I have, right? So like really reframe about like not what you don't have, but where you're going to be. And then the question I said before is, but can you solve a problem? Can you help? That's all that matters. If you can help, it doesn't matter that you had 10,000 hours. Like people just want help. So with my very first job, the reason why I got it, I was an intern, is, okay, I'm dating myself. No, nobody knew how to use Excel. I knew how to use Excel, and I also knew how to use Google to Google Excel, advanced Excel things. It was so simple, right? And the next thing I know, I've got a full-time job at this place just because I knew how to do something that other people didn't know how to do. And I had just stepped out of undergrad. So I didn't have any experience on the job, but I could solve a problem that would help them get $1 million contract because I knew how to write Excel formulas and they didn't. So it doesn't have to be some big monumental thing that you know how to do, solve a problem.
Yeah, there's nothing more I can add to that. Excellent advice. I agree with both.
Well, on behalf of DCPHA, thank you again to our three wonderful speakers, and thank you all for joining today's webinar. We hope you enjoyed it. If you have any questions, please email us. To our speakers, if you don't mind, throw your emails into the chat. I think that's a great way for hopefully you to continue your network building, but also to all of us who would love to get to know you a little bit more. This webinar will be archived and we will be sharing it on YouTube. So to those three ladies who are speakers, you got that to market yourselves, but also in case you missed part of the webinar, we will be promoting that within the next couple of days.
I just want to thank all of you for coming tonight. When I thought up this idea, like a year or two ago, you were the three speakers who immediately came to mind. I see you in my feeds all the time, and I'm really proud of the turnout tonight. Proud of you all, and I would encourage everyone on the call, please visit dcmetropha.org. We're looking for volunteers. We're looking for people to join our governing council if you're interested in being involved in the community, in public health, in rebuilding an organization. It's a great experience. Please join us, and looking forward to seeing you in the future.
Thanks, everyone. Have a good night.